Welcome to RelapsePreventionPlan.net's free online rehab lessons. We believe that it's never too late to learn to prevent relapse. Welcome to this presentation on sleep and relapse prevention. In this presentation, you'll learn to list 3 ways sleep restores the body, list 5 negative effects of sleep deprivation, and list 3 changes you can make to improve your sleep. So why is sleep important? In a study of factors positively linked to health and long life, sleep came first, followed by exercise and eating breakfast. Too little sleep results in low energy levels, lack of concentration, poor judgment, impaired decision-making, more frequent mistakes, increased irritability, increased memory loss, increased depression and stress, poor work performance, and increased risk of accident and injury. Too little sleep also increases the risk of sickness. It increases the risk of diabetes, heart disease, and obesity. Headaches, stomach problems, and sore joints occur after only a few nights of 5 or 6 hours sleep. Too little sleep causes a weakened immune system because fewer white blood cells are produced, and increased risk of infections, and a longer recovery time from infections or injury. Too little sleep increases the risk of injury because sleep debt is cumulative. Performance on tests of alertness and thinking continue to get worse the longer the sleep deprivation. Each year in America, drowsy drivers cause 100,000 crashes, resulting in 76,000 injuries and 15,000 deaths. Studies show that being sleep deprived has a similar effect on performance as being intoxicated. Poor hand-eye coordination, mood swings, depression, and feelings of tension. Partial sleep deprivation means you get some sleep but not what you need. After one night of short sleep, most people function near their normal level. After 2 or more nights, though, you experience increased irritability and sleepiness. Your work performance suffers, you end up with headaches, stomach aches, and joint pains, and there's a risk of falling asleep while working or driving. And 3, in the long term, less than needed sleep for months or years, such as during the addiction lifestyle, means that men are 3 times more likely to die than those with adequate rest. Women are more likely to develop heart disease. There are fewer promotions. You'll stay at a lower pay grade. You're more likely to be hospitalized. You do worse on all performance measures. And you crave carbohydrate-rich foods like cakes, candy, ice cream, and pasta. And there's increased obesity. So, how much sleep is necessary? No one can live without any sleep. 2/3 of people sleep an average of 7.5 hours per day. But how much sleep you need depends on your genetics and your overall state of health. Among the general population, a very few people need only 4 to 6 hours a day. A very few people need a lot, or 9 to 10 hours a day. Most people need about 7 or 8 hours of sleep per day. So how much sleep does it take for you to feel fully rested? To determine your sleep needs, you have to listen to your body. You are fully rested when you find it easy to get out of bed, are not sleepy during the daytime, don't have problems concentrating, and are generally in a good mood. You are probably sleep deprived if, along with feeling drowsy in the daytime, you struggle to get out of bed, are frequently irritable, have difficulty concentrating, and nod off or come close to nodding off after eating, at the movies, watching TV, or while driving. Sleep has phases. So during the night, a normal sleeper moves between different sleep stages, alternating between non-REM or quiet sleep and rapid eye movement or dreaming sleep. Non-REM or quiet sleep happens in the first 5 minutes as a transition from wakefulness to light sleep. The next 10 to 25 minutes, eyes still, heart rate and breathing become slower, and you are still poised to be awoken if needed. And then deeper and deeper sleep. Deep sleep is a healing time. It's the time your body uses to renew and repair itself. At the beginning of the deep sleep phase, the pituitary gland releases a pulse of growth hormone that stimulates tissue growth and muscle repair. Your body releases increased blood levels of a substance that activates your immune system. Going to sleep and waking up. The sleep-wake rhythm causes most people to sleep from about 10:30 or 11:30 p.m. to 6:30 or 7:30 a.m. A small percentage of people have an inborn tendency to go to bed early, between 9 and 10 p.m., and wake up early, between 5 and 6 a.m. Also, a small percentage of people have a natural desire to stay up past midnight and sleep until late morning. As we age, we have a tendency to go to sleep earlier and wake up earlier, by about an hour. The circadian rhythm is the daily cycle of sleep and wakefulness. From the Latin circadian, meaning about a day. It refers to the fact that the body rhythms work on a 24-hour pattern. Circadian rhythms regulate body functions including digestion, elimination, and sleep. They are triggered by nerves and chemical messengers, and they are controlled by the hypothalamus in the brain. But addiction disrupts your circadian rhythms. During addiction, patterns of waking and sleeping are severely disrupted, and as a result, judgment is impaired, susceptibility to disease increases, exhaustion of mind and body increase the risk of relapse, and the lack of sleep affects other daily patterns, including work, eating, and exercise. Recovery is jeopardized as stress increases from lack of regular quality sleep. Alcohol negatively affects your sleep, and when taken near bedtime, it initially shortens the time required to fall asleep, but it results in short periods of light sleep interrupted by periods of wakefulness, and return to sleep is difficult. The negative effects of sleep deprivation occur when alcohol use continues day after day. The person who abuses alcohol becomes continuously sleep deprived. And alcohol abuse affects sleep patterns for a very long time. For up to 2 years, people may continue to experience increased time required and more difficulty in getting to sleep, frequent awakening after getting to sleep, poor overall sleep quality, and sleep deprivation and daytime drowsiness. Resumption of drinking often results in falling to sleep quicker in the short term, which is a factor in relapse. The benefits of sleep. The only way to erase sleep debt is just to get more sleep. People who make an effort to get regular, sufficient sleep experience an improvement in alertness and performance, memory, concentration, and creativity, and overall health. So researchers have disproved some very common sleep myths. You need less sleep as you get older. Older people need just as much sleep as younger people. Alcohol helps you sleep better. Its sedative effect helps you fall asleep faster, but you get less deep sleep, so are less refreshed by sleep, and are more likely to wake up in the night, more likely to snore, and to have breathing problems at night. There's something wrong if you don't remember your dreams is another sleep myth. Some people remember dreams and some people don't. Not being able to recall dreams is normal and has no negative health effects. Another myth is that I can get fine on 5 or 6 hours of sleep, where the overwhelming majority of people need 7 to 9 hours a night. And the chances are relatively small that an individual needs little sleep. So another sleep myth is that you can learn to get by on less sleep. There is no way to train the body to reduce its sleep need. Less sleep means you feel more tired, work less efficiently, and get less done. Another myth is that insomniacs barely sleep at all. People with insomnia typically get a few hours sleep at night, but it's very hard to tell how long we sleep because we don't experience time passing while we are asleep. Napping is a bad habit? Well, if you experience the occasional night of short sleep, a brief afternoon nap is a great way to replace lost sleep. Is it possible to get too much sleep? You can't get more sleep than your body needs. If you continue to sleep, it's because you need more sleep. Sleeping 9 or 10 hours as an adult may be a sign of sleep apnea, which results in poor quality sleep. And people who are depressed stay in bed for long periods of time. So how do you get a good night's sleep? First of all, recognize the importance of sleep. Block out enough time to get the sleep your body needs. Adopt a healthy lifestyle, such as exercise regularly, maintain a healthy diet, don't smoke, don't take drugs, and don't drink excessively. Maintain good sleep habits, such as keep a regular sleep-wake schedule 7 days a week. Eat meals and exercise at consistent times. Develop a pre-sleep routine to cue your body for sleep. And use relaxation exercises and meditation before bed. Also, reserve the bed for intimacy and sleep, not phone calls, snacks, or watching TV. And avoid frequent naps or napping in the evening. Create an optimal sleep environment by controlling noise, such as using earplugs, have heavy rugs and curtains, disconnect your phone and doorbell at night, and use white noise like a fan to create a steady hum. Block out light. Use thick curtains, blackout shades, and cover electronic devices that have light displays. And you can wear eye shades. Control the temperature where you sleep. Keep it cool and well ventilated. Hide the clock face or turn it around. And use comfortable mattress, pillow, pajamas, and blankets. Getting a good night's sleep means stop smoking or chewing tobacco. Nicotine speeds your heart rate and increases your blood pressure and causes fast brainwave activity. Avoid nicotine and you will fall asleep more quickly and wake less often during the night. Find the right balance of fluids. So use common sense for this one. If you wake up often at night to go to the bathroom, cut back on fluids, especially in the evening. But if you're often thirsty at night, have something to drink before bed. And avoid foods that give you heartburn. Watch out for and avoid sleep thieves. Excess caffeine, because caffeine lengthens the time to fall asleep and reduces the amount of deep sleep you get. It is a diuretic and disrupts sleep by making you get up to go pee. It takes 3 to 5 hours for caffeine to clear your system, so Avoid more than 2 or 3 cups of caffeinated coffee, tea, soda, or chocolate per day. If you have trouble sleeping, avoid caffeine after 2 p.m. So, number 2 is disruption of the circadian rhythm, such as shift work, irregular sleeping patterns, jet lag, keeping irregular hours, staying up late on weekends and sleeping in, and being up early for work and late to bed. Number 3, exercising within 2 hours of bedtime is a sleep thief. It causes sleep problems due to increased adrenaline production. Poor physical and mental health also disrupts sleep, such as lack of daily exercise, lack of mental activity, lack of motivation and fulfillment, and unmanaged anxiety and depression. Snoring also impacts sleep, and 45% of adults snore occasionally, and 25% are habitual snorers. It is more frequent in males and overweight persons, and it usually grows with age. And it's often worsened by sleeping on your back. So here's a review of very simple ways that you can improve your sleep. Number 1, exercise discipline about sleep routines. Establish regular times to sleep and get up, because regularity keeps body rhythms constant. Rise early and go to bed early, before 11 p.m. because going to bed late interferes with natural rhythms and with deeper sleep. Number 2, eat a balanced whole foods diet. A low-fat diet reduces depression and enhances mental well-being. Eat 3 meals each day at regular times, and eat the evening meal at least 2 hours before bedtime. Low blood sugar can disturb sleep, so a very light late-night snack of oranges, bananas, milk, or toast may aid sleep. And avoid alcohol. Getting active helps to improve your sleep, because sleep is a natural response to physical activity. Regular exercise helps to increase the amount of deep sleep. Regular exercise and sleep together help to strengthen the immune system and fight disease. So another way to help is to reduce snoring. For mild or occasional snoring, adopt an active lifestyle and get regular sleep. Avoid tranquilizers, sleeping pills, and antihistamines before bedtime. Avoid heavy meals or large snacks for at least 3 hours before bed. And try sleeping on your side rather than on your back. And you can tilt the head of your bed upwards 4 inches. It's pretty easy. You can just set your bed legs on blocks, or use a wedge pillow. Snoring means obstructed breathing, so seek professional help if necessary. You can improve your sleeping area to improve your sleep as well. Choose a quiet location, decorate with colors and items that create a restful and peaceful feeling. Use a comfortable bed, and ensure adequate room ventilation, and reduce the light in the room with heavy curtains, and lower the room temperature. Use comfortable pillows and blankets, and keep your room clean from dust and insects that interfere with sleep and cause disease. Wash bedding at least weekly, and keep TVs out of the bedroom, and keep pets out of the bedroom or restrict them to the floor. You can also improve sleep by creating restful pre-sleep routines, like meditation, or using relaxation tools like deep breathing and creative visualization. You can listen to calming music or take a warm bath. But before bed, avoid reading work-related materials or upsetting or overly exciting TV programs or books. You may still have problems sleeping after doing all these things to improve your sleep, but sleep patterns can be disrupted during immediate recovery and for up to 2 years following abstinence from drugs and alcohol. So don't give up. Continue to use the suggestions and use relaxation techniques during the day and before bed. And if you still have problems sleeping and you've tried all of these suggestions and are still having difficulty, you may wish to consult with your doctor or an expert in problems with sleeping. Here are the references for this presentation. Pause if you'd like to write any down and look them up. Congratulations, you've finished this presentation. You should now be able to list 3 ways that sleep restores the body, list 5 negative effects of sleep deprivation, and list 3 changes you can make to improve your sleep. Don't forget to complete Chapter 3 in our free downloadable workbook, Make Your Last Relapse the Last, downloadable from relapsepreventionplan.net. Remember, this video is not a substitute for proper medical care and consultation with your physician or qualified healthcare professional. Don't ignore professional advice or delay seeking treatment based on the information in this video or on this YouTube channel. Thank you for joining us. You can do it. We believe in you. Don't give up.